Approved. All right, so here are some examples of projects, and one second. Okay, so here are some examples of projects. So, um, uh, building a congestive failure order set, that was a fairly big job. Um, we created a SOFA tool. SOFA is is sort of the new version of sepsis. It hasn't completely penetrated, but it's being used in certain situations. I was heavily involved with a pilot for critical lab notification via Haiku, which is the mobile application for Epic EHR. We built an order set for the tracheostomy team. We worked on the blood conservation program, which is to help avoid blood transfusions for patients who refuse, who don't allow blood transfusions, typically Jehovah's Witnesses. We created best practice advisories for echocardiograms and cardiac rehab for patients who had myocardial infarctions. We pre-checked hemoglobin A1C in the insulin order set if the patient hadn't had one in 3 months. There was an orthotics consult order, a multimodal pain medication order set, and a smartphone app for the health system. And I'll go into a little bit of detail for some of these. So for CHF, we had three different hospitals, and we got cardiologists and hospitalists and nurses together to come up with a consensus. It wasn't so easy. Two of the three hospital, well, one of the three hospitals had very specific ideas what they wanted in there, and not everyone agreed. And we actually ended up creating a separate order set just for that hospital, which we didn't do that again. So anyway, the kinds of order we put in there, LASIX, ins and outs, daily weights, echocardiograms, and we used evidence-based medicine and guidelines, and the order set is used quite a bit. The SOFA tool, again, SOFA is kind of like Sepsis. It's a scoring tool in Epic. And the reason this was kind of an interesting story because the reason we did this was the beginning of the COVID outbreak, and they had been rationing ventilators in Italy when this first started. If you remember, it hit Italy very hard. It hit New York first in the United States, and there was a lot of concern about whether they'd have enough ventilators. So New York and then other states after that created a system to score people's chances of survival. And if the chances were low, then they would not get a ventilator. And I'm very thankful that we never had to pull the trigger on this. But it was a very interesting application of EHR to deal with possible rationing, which never happened. This is what the SOFA score looks like, and I wanted to show my face. Okay, and so this is basically there's a series of systems. You get a certain number of points for each system, and then you get a score. All right. Okay. So what is the typical work? Typical work is for critical lab notification was we created a system of automatic notification for providers via smartphone. And this was one reason to do this was to decrease expenses, so we wouldn't need as much manual work, and also to shorten the turnaround time for notification. And I designed the workflow, we validated the build. The hardest part, it turns out, for this was provider adoption. We had a very difficult time getting every provider to use their smartphone. And it's still an issue. I think we're getting better, but yeah, that's not an easy nut to crack. We created an order set for the tracheostomy team. We worked with respiratory and speech therapists from three hospitals, and we created an order set, which worked out well. Blood conservation system, we designed a best practice advisory or alert when ordering blood if it was known that the patient did not accept blood products. We created two best practice advisories for myocardial infarction. So basically, it was a rule that if a patient had an MI that admission, and they didn't get an echocardiogram ordered or cardiac rehab wasn't ordered, you get an alert to remind. And we found that this improved utilization, so that was great. Um, we had a lot of patients who um, had diabetes or pre-diabetes, but they hadn't had a hemoglobin A1C checked for quite some time. So what we did was we created a rule so that if you are using the insulin order set for diabetic, and this was, I don't know, not 100%, but if you did use it, and if the hemoglobin A1C had not been um, tested within 3 months, then it would automatically pre-check the order. And these are the kinds of informatics changes that I like the most, the things that are behind the scenes. The provider might not even know that it's happening. Um, and it's just very smooth. And there's a lot of informatics um, changes that uh, interrupt providers' work, and that can cause something called alert fatigue, where you get so many alerts that you actually end up overriding all of them, which is not a good thing. So these are the kinds of things that I love to see. I created an orthotics consult order, which sent an automatic email to the orthotics vendor. This was a big one, the multimodal pain medication order set. We'd had one for orthopedic surgery, which included, both opiates and non-opiates, because a lot of people, I think there's overutilization of opiates. There's sort of a lack of awareness of what kinds of things you can use, what are available for pain that are not opiates. So we created, so this was again a large multidisciplinary team from all three hospitals, and we included orders for both opiates and non-opiates, and we had hospitalists, psychiatrists, anesthesiologists, nurses, and pharmacists, and that's a great order set, and it's used a lot. And then I think this is the last one. We created a smartphone app for the health system, and we worked with analysts basically to have just one place that had all the important information, particularly phone numbers for departments in the hospital and other things.